Well, it is sad but true. The man's story is quite common. Many older adults end up quite addicted to very strong and potentially harmful medications that end up interfering with the quality of their life. People over 65 years of age account for a third of all the prescriptions written in the United States. This statistic is even more shocking with the knowledge that the segment makes up only 13% of the population. As in this case, over many years of care, it is not uncommon for someone over the age of 60 to be taking more than 5 medications in one day. This is even more common in women. Many of the drugs seniors take are for pain management, such as opiates, and anxiety drugs as sleep aids include benzodiazepines. Many seniors see multiple doctors or use mail-order pharmacies. So often, the prescribing doctor does not have a complete picture of what they're taking. These patients are savvy and know ways to get extra supplies. In this example, the old lady in the shoe was seeing multiple doctors and called for refills without seeing the doctor. Because the doctor was their family doctor and has seen this patient over the course of many years, he felt comfortable refilling over the phone, without questioning the patient as to why she would run out of these drugs early or lose them. She needed to be evaluated to rule out possible drug tolerance and possible misuse. The doctor was also not bringing the patient in at least annually to review the course of treatment and take into account the slowing metabolism, which might require changes in the client's drug protocol. Statistically, it is easy to see this is a growing problem for aging patients. From the years 2004 to 2008, there was a 121% increase in emergency room visits involving prescription drug misuse by older Americans. In this case, the doctor has not managed his patient's medication well. Use of benzodiazepines for prolonged periods of time have been associated with depression and cognitive decline. Symptoms such as these can be difficult for doctors to attribute to drug misuse because those and many other symptoms associated with drug abuse mimic typical signs of aging. Additionally, the elderly do not fit the common profile of a drug abuser, and resources for this population are not sufficient. Wow, you guys, what a great conversation we've been having. Up next, we have Dexter with his client Pokey.